When you think of a nurse, what comes to mind? A bustling hospital? A long shift in scrubs under fluorescent lights? Now imagine something different. A nurse walking up a quiet front porch, greeted by a smiling patient in their own living room, not just treating illness, but bringing care, comfort, and healing into someone's home. This is a day in the life of a Heart of the Rockies home health nurse, and it's more meaningful, complex, and heart-centered than you might think. 1. The morning routine. Planning with purpose. For our home health nurses, the day starts before the first knock on the door. They review their schedule, update care plans, check in with the medical team, and prepare supplies, from wound dressings to medication kits. Every visit is different, and every patient has unique needs. Each stop on the nurse's schedule is someone's home, someone healing, someone hoping for comfort, reassurance, or clarity, and that's exactly what our nurses bring. 2. First visit, skilled care, right at home. The first visit of the day might be a recent post-surgery patient. The nurse checks vital signs, blood pressure, temperature, oxygen levels. She carefully unwraps a wound dressing, assessing healing and signs of infection. She speaks gently, explains each step, and encourages the patient to ask questions. This isn't a rushed 5-minute check. It's personalized, attentive care, on the patient's terms, in their space. She documents everything, checks medications, ensures follow-ups are scheduled, and leaves the patient more informed, more confident, and more comfortable than before. 3. Midday rounds, from medication to motivation. Next up might be an elderly patient managing multiple conditions. Here the nurse isn't just handing out pills. She's reviewing medication lists, monitoring for side effects, ensuring doses are taken correctly, and communicating with physicians if anything changes. But beyond the clinical tasks, she also brings conversation, encouragement, and emotional support. She reminds them they're not alone in managing heart failure, diabetes, or COPD, that someone sees them, listens to them, and believes in their ability to heal at home. 4. Coordination of care. The behind-the-scenes hero. A huge part of a home health nurse's day happens behind the scenes. Between visits, they call doctors, update electronic health records, coordinate with physical therapists or social workers, order supplies, handle unexpected symptoms or family concerns. They're the bridge between patient and provider, home and hospital, independence and safety. In many cases, the nurse becomes the lifeline for families trying to navigate complex care plans, and they do it all with compassion and skill. 5. Patient education. Empowering health education is one of the most powerful tools in a nurse's toolkit. Whether it's teaching a patient how to manage a catheter, explaining the side effects of a new medication, or showing a caregiver how to take blood pressure, the goal is to empower, not just treat. At Heart of the Rockies, we believe healing doesn't stop when the nurse leaves. It continues when the patient feels confident enough to take charge of their own health. Our nurses don't just care for people, they teach people how to care for themselves. 6. Healing at home. Why it matters. Research shows that patients often heal faster at home. Why? Because they're surrounded by comfort, routine, and loved ones. Home health nurses bring the best of both worlds, hospital-quality care with the warmth of home. And for rural communities or aging adults with mobility challenges, they're not just caregivers, they're lifelines. That's what we do at Heart of the Rockies Home Health Care, bring healing where it's needed most. Behind every successful home recovery story, there's often a nurse, driving from house to house, one heartbeat at a time. What makes a great home health nurse in your eyes? Tell us in the comments. We'd love to hear. And if this gave you a better understanding of what home health truly looks like, give it a like, subscribe, and follow Heart of the Rockies Home Health Care, where care meets compassion, right at home.